In this research rundown entitled Alternative Uses of Hyperbaric Oxygen Therapy in Military Medicine, Current Position and Future Direction. So this is how we're going to look at how we treat our military personnel. And one thing I can say is that it is funded by the U.S. Navy, but it's not the position of the U.S. Navy. This is the position of the individuals involved in this study. And the study involved no research, so they had no patients where they actually treated them and had some clinical experience in that regard. They did look at a number of trials that are out there, and it's just confusing for me. I read through this, and it seems to me that they were trying to, I think, create some confusion and build a case against hyperbaric oxygen in its use for traumatic brain injuries. And it's unfortunate. There's some really good studies that are not included in that list that were very conclusive. And some of the studies in the list were conclusive as well. So I don't see where they're coming up with their conclusion, but let's just read their conclusion. Hyperbaric oxygen therapy is recognized as safe. Okay, that's good. Commonly used medical procedure, because there's 13 FDA approved indications, wound care and the bends and things of that nature. However, there's an ongoing debate. So who's debating? That's the nothing to see there. That haven't been evident in controlled randomized clinical trials, thereby failing to reach a significant level of scientific evidence that's going to mandate. So they want to say, is there enough to mandate or support this treatment for medical prescribed applications as far as PTSD, mild traumatic brain injury, and traumatic brain injury. So let's just not use it, really. So this is really significant, I think, because if you're in the military or you have a loved one that is serving our country, it's a study like this that prevents it from being used on our personnel. So if someone gets a traumatic brain injury, and in my experience, just put this aside because to me that's worth less than the toilet paper. My experience, putting that aside, is that I've seen the hockey players get a serious traumatic brain injury. Dark sunglasses, other injuries, they're limping, You can imagine that happening to a soldier when an ID goes off. Going into a hyperbaric chamber and coming out after 2 or 3 treatments and hugging the attendants because all of that pain is gone. 2 things. One of them is that first thing the military has to recognize, or these individuals making these important decisions for our soldiers and servicemen, is that they have to recognize that, or accept and acknowledge that there's inflammation when your head gets slammed against a pressure wave or a bulkhead or whatever it is. And so if you can't first take that step and say there's inflammation, and then long term with PTSD and the stress and everything else that cascades from that, and the drugs that are given to the individual, is there still inflammation? Because we're not going to connect PTSD with TBI. And I think, I just think you have to take a step back and say there is just some common sense things that apply here, and this bullshit about more animal studies and more research. We need to move past it. And we just need to treat, because there's been thousands of soldiers that were contemplating suicide whose lives have been saved with hyperbaric oxygen. And so we just got to stop this madness. So that's what I have for today.